Hi, my name's TJ Gray. I'm a family physician at Mountain View Medical Center in Forest Grove, Oregon, and we've been on Centricity for 4.5 years. Just learning the computer and what to type in, I think that was all new for us because we had been on a paper system prior to that. And we were back to full production, I think within a week or two. I think that came from a lot of prep early on. One thing that I recommend to new users is to listen to the implementation team. We took extensive notes. Every time they recommended we do something, we actually did it. And I think that's where some implementations probably fail, where the team doesn't actually take people seriously, that you actually need to come up with a lot of answers prior to implementing. It's just how it works. The system will be ready for you if you've put the thought in ahead of time. And we did that. So it went pretty smooth and we were able to get back to full production very quickly. I hear some groups go longer. It takes months. And the other thing I think is that we're dedicated to making it work. I don't even remember doing a lot of extra hours at first. Maybe staying a little hour longer a day at first, but I felt like we had made a lot of the kind of clinical workflow decisions ahead of time, which helped make it a smooth transition. I can't imagine running an office without an electronic record at this point, and that's what I've heard from everybody when they'd never go back. Most every workflow has been improved actually by the electronic record. I try very carefully to keep the computer work from interrupting the patient care and the discussion. There are many advantages to the computer, and patients see that. They see that in their lives, and I think many of them are happy to see that we're engaging with technology, and they understand that can actually make us better providers because we have a better system. One thing I think the computer does a little better than the old paper notes is it helps me, it does so many things better, but it helps me systematically implement care coordination and care guidelines that our paper system I felt was a lot weaker on. A lot of doctors don't use a medical scribe. And I think you have to actually be an expert in your computer system before you do shift to a scribe. The scribe is just typing what you're asking them to type. And so what I've found in my experience is that I have about 30% more time face-to-face with a patient, along with better chart notes that are more accurately documenting what's happening in the exam room. It's literally a time issue. She'll type furiously for the whole 15-minute visit, and that's something I wasn't able to do, so we get more data into the chart note. A scribe adds another person in the room, so there is that dynamic, but I found that if you introduce her properly, the patient don't seem to mind. And in fact, they often find, once they realize after a couple visits that I'm spending even more time talking with them, they appreciate it. So it helps me. The reason I say you need to be an expert is because since you're directing the scribe, it's really probably not for the person who doesn't know how to use the system and hopes that the scribe's going to help them figure that out. You actually need to learn how to use the system and then use the scribe to extend you. And that's what I've been doing. And it's been really successful in helping lower that kind of burden on the provider that that an electronic system does. It's just part of what's changed as we've gone to electronic records. When you're looking at the primary care medical home, you're trying to improve community care, and this is where an electronic system like Centricity that we're using has allowed us to shine. When you can look at discrete pieces of data and then aggregate those across all the patients that you're seeing, you can, one, improve the care you're giving, by learning that maybe you weren't doing so well on your A1Cs as you thought, or perhaps maybe you're not getting as many mammograms as you thought. The primary care medical home then is tracking that using some staff member in the background and getting some resources from the state to help pay for that. So it's a way of helping us advance in our efforts to more, expertly use the computer system that we've installed. It grabs those discrete pieces of data in a much different way. You can't do it with paper. You just cannot look at all the paper in those files on the wall and get any kind of this kind of information. When we implemented Centricity, we took a tour of a couple other offices that were on the system. And I remember walking in and wondering where everyone was and if they were at lunch or closed. And they assured me that when we went from paper to electronic, there would be a change in the people that needed to push charts around. Obviously, when you have one paper chart, only one person at a time can use it. And with the complexity of medical care and the way we're trying to deliver that now, that is virtually, it's becoming more difficult. I can't say impossible because it's still being done, but so the same thing happened to us. About a year later, as we had moved most of the charts back into their, dusty bins at this point, the office quieted down. No one had to be walking around. They could message each other. If someone needed the chart, they just pulled it up on any computer, anytime. The first step is to really pay attention to the implementation process. And if you take a step back from that, I think this system, we researched it highly. We looked at about 30 or 40 different systems, and this met our needs for a system that works for a small office, that you can grow into, that allows you to do all those steps you need with primary care home and the discrete data. There's lots of systems out there, and I think it's a hard choice. And frankly, I'm very happy every day we chose this one. You want a system that's actually going to give you data on the backside that's useful. And a lot of systems out there, essentially they're just electronic paper. They just have a bunch of notes with no discrete data points, but you can't measure over time. For example, I use the graphing function for patients' blood pressure frequently, and if that's not in a discrete data point, it'll never be able to be graphed. It's just in a chart note. So, I think for any group that's thinking of growing with all the new regulation, you need a strong presence. I think that's where, this is General Electric owned product. I think that they've got your back. There's a national meeting that you can go to every year, and good support locally with HealthCo. Our overall experience with HealthCo has been excellent. It's a good organization to work with. They're responsive. They answer our questions and help us out whenever we need it.